Hi everyone, welcome back in today's video. In this tutorial I am going to show you types of IV fluids and their uses. So in this video we shall learn types of IV fluids and their uses. We have different types of IV fluids based on their tonicity. For instance, we have isotonic IV solutions, we have hypertonic IV solutions, and we also have hypotonic IV solutions. We shall see one by one. Okay, let us start with an isotonic IV solutions. Isotonic IV solutions, these are solutions that have the same solute concentration as blood plasma. For instance, we have ring lactate. So this is a ring lactate. We also have sodium chloride. We also have dextrose 5%. So these three are isotonic IV solutions. This is because they have the same solute concentration as blood plasma. Example include, we have RL, that is ring lactate. So ring lactate is an isotonic solution because it has the same solute concentration as blood plasma. Okay, we also have sodium chloride, which is also known as normaceline. It's also an isotonic IV solution because it has the same solute concentration as blood plasma. Okay, we also have dextrose 5%. This is also an isotonic IV solution because it has the same solute concentration as blood plasma. Okay, we also have hypertonic IV solutions. Hypertonic IV solutions, these are IV solutions that have greater solute concentration than blood plasma. Okay, we also have hypertonic IV solutions. Hypertonic IV solutions, these are IV solutions that have a greater solute concentration than blood plasma. Example includes, we have dextrose 10%. So this is a dextrose 10%. It is a hypertonic IV solutions because it has a greater solute concentration than blood plasma. Okay, we also have DNS, that is dextrose, a combination of dextrose and sodium chloride. So this is a DNS. It is also a hypertonic solution because it has a greater solute concentration than blood plasma. Okay, we also have hypertonic solutions. We also have hypertonic IV solutions. Okay, what are hypertonic IV solutions? These are IV solutions that have a lesser solute concentration than blood plasma. Example include, we have dextrose 5%. So dextrose 5%, it is also a hypotonic solution because it has a lesser solute concentration. Okay, we also have 0.45 normaceline, that is sodium chloride, which is also a hypotonic solution because it has a lesser solute concentration. We also have 0.22% of sodium chloride. We also have 0.33% of sodium chloride. It is also a hypotonic solution. Okay, we also have glucose 50%. Okay, now let us start by the uses of IV fluids. Okay, let us start with ring lactate. So this is a ring lactate. It is an isotonic solution. So it contains sodium lactate, sodium chloride, potassium chloride, and calcium chloride and electrolyte. So we use ring lactate to administer a patient who has the following condition. For example, dehydration, and experience burns, traumatic injury, undergoing surgery, or a patient who has a gastritis. Okay, that is the uses of ring lactate. What about contraindication? So you have to be very cautious whenever you administer ring lactate. You cannot administer to patients who have a liver problem or a kidney problem. You also avoid, you must also administer caution to patients with a high blood pressure. So if a patient has a high blood pressure, you cannot administer ring lactate, but you can opt out sodium chloride normaceline. Okay, we also have sodium chloride. This is a normaceline. It is also an isotonic solution, so it contains water sodium chloride and electrolytes. So we use it to administer for patients who experience blood loss, fluid loss, dehydration, sepsis, that is a severe blood infection, hypovolemia, hemorrhage, and burns, traumatic injury. Okay, what about contraindication? So you have to be very cautious about a patient who has a cardiac failure, renal failure, and pulmonary edema. You cannot give to sodium chloride to a patient who has the following condition: cardiac failure, that is a congestive heart failure. You cannot also give to a patient who has a renal failure. You cannot give to a patient who has a pulmonary edema. So that is all about sodium chloride. Okay, we also have dextrose 5%. So it is also an isotonic solution. We use it to administer a patient who experience fluid loss, or maybe we can also use to give if there is a depletion, high carbohydrate depletion, if the patient is unable to drink or eat anything. So you can administer to a patient who experience fluid loss or carbohydrate depletion. You can also administer to a patient who is unable to drink or eat anything. So feeling weakness, tired, fatigue, unable to eat or drink something, you can administer to a dextrose 5%. What about contraindication? So you cannot do fluid reconstitution with a dextrose 5% because it will cause hyperglycemia. So you have to be very careful. You have to be very cautious in administering to a diabetic patient, for a patient who has a high blood sugar level. So you have to be very careful when you're giving dextrose 5%. Okay, we also have D10. So this is a dextrose 10%. It's a hypertonic solution. So we use it to administer to someone who has experienced an hypoglycemia, that is reduced blood sugar level in the blood. So you can give dextrose 10% to a patient who experienced an reduced blood sugar level in the blood. You can also give to a patient who is unable to eat or drink anything, experience severe dehydration, when a patient is in shock. Okay, we also have DNS. So this is a DNS, which is a combination of dextrose and sodium chloride. So we use it to administer to a patient who experiences blood loss, fluid loss, or carbohydrate depletion. So that is all about DNS. That is a combination of dextrose and sodium chloride. Okay, we also have glucose 50%. So this is a glucose 50%. We use it to administer to a patient who has experienced hypoglycemia. That is a patient who has experienced reduced blood sugar level. So we use glucose 50% to give a patient who has experienced reduced blood sugar level, that is hypoglycemia. So these are the different types of IV fluids. So why do we take IV fluids? So we take IV fluids if we experience fluid loss or blood loss in our body. So we lose a lot of fluid in our body through sweating, traumatic injury, maybe severe bleeding or dehydration. So we need IV fluids to restore and maintain our normal body fluid. So these are the common types of IV fluids we generally use. So you have to be very cautious whenever you're administering one by one. What about someone for a pregnant woman? So all of this, they have no any impact. They have no any negative impact on pregnancy. You can administer safely during pregnancy, depending on the dose or maybe the volume of liquid you want to administer to the patient, and calculating based on their weight, calculating based on their body weights. So you have to consider that. So please, if you find the video helpful, please kindly hit the subscribe button, like and share, and give your comment to this video. So thank you for your watching. Have a nice day.